Three companies control 90% of the market. Of the U.S. infant formula market, each operating at gross margins above 55%. That margin isn't funding nutritional advances. It is funding expensive hospital contracts and a branding machine that starts in the maternity ward. Today, 10 infant formulas ranked. 5 priced on fear and captive hospital access. 5 where the money actually goes into the can. Starting at number 10, a formula whose brain-building label is funded entirely by its own manufacturer. In 10th place, Enfamil NeuroPro positions itself as the science-backed choice for infant brain development. Reckitt's flagship formula built around MFGM, milk-fat globule membrane, and DHA, marketed as closing the cognitive gap between formula-fed and breastfed infants. At number 9, we have Similac 360 Total Care. This product markets itself as complete nutrition, anchored by 5 human milk oligosaccharides, prebiotics. Prebiotics Abbott calls HMOs, positioned as immune support from day one. Yet Abbott's pediatric nutrition gross margin has consistently exceeded 55%, according to the company's annual reports, sustained not by ingredient superiority alone, but by a hospital distribution infrastructure assembled over decades. Abbott's exclusive formula supply agreements with U.S. hospitals, documented in WHO infant and young child feeding monitoring reports, provide maternity wards with free Similac starter kits. Establishing brand loyalty before a parent ever makes a single purchasing decision at retail. Following a February 2022 FDA Form 483 inspection finding Chronobacter sakazaki contamination, the resulting shortage disrupted approximately 40% of national formula supply, according to U.S. Department of Health and Human Services datasets, and an HMO marketing claim not for nutrition unavailable in a $16 store brand alternative. In 8th place, Gerber Good Start presents the Comfort Proteins label, using partially hydrolyzed whey protein, marketed as being gentler on infant digestion and, implicitly, as protective against allergy. A 19.4-ounce container retails between $28 and $33. Yet the FDA's own official language on the matter, of the Gerber Good Start Qualified Health Claim, granted in 2011 and still printed on packaging, explicitly states the following official statement. FDA has concluded that the relationship between 100% whey protein, partially hydrolyzed infant formula products used in these infant formula products, and the reduced risk of atopic dermatitis is uncertain because there is little scientific evidence for the relationship. Gerber is required by the FDA to print that uncertainty disclaimer on every single qualified claim. Nestlé's baby nutrition segment generated approximately $10 billion in revenue in 2023, according to the annual report. According to the company's annual report, is supported by a global distribution infrastructure. The 2023 WHO and UNICEF Global Monitoring Report cited for violating the International Code of Marketing of breast milk substitutes in multiple countries, including paying healthcare workers to promote formula, a practice banned under the code since 1981. The verdict: you are paying for a claim. The FDA itself certified as uncertain, not for a scientifically established nutritional benefit. Number 7, Earth's Best Organic, under the Hain Celestial brand group, markets its infant formula as the clean alternative, nurturing baby the purest way, with USDA organic certification as the implied guarantee of safety. A 23.2-ounce can retails between $33 and $40, commanding a $12 to $8 premium over store brand formula, meeting identical FDA 21 CFR Part 106 nutritional requirements. Yet, USDA organic certification, applied to the farming of the raw ingredients used, does not test for heavy metals, arsenic, lead, cadmium, and mercury, which enter the food chain at the soil and water level regardless of whether synthetic pesticides were used. In February 2021, the U.S. House Subcommittee on Economic and Consumer Policy documented the findings. Hain Celestial's baby product line, including Earth's Best branded products, contained dangerous levels of all 4 heavy metals in the company's own internal testing records. The USDA organic certification the formula premium is built on does not address, test for, or place limits on any of the contaminants that the investigation documented. The verdict: you are paying for a farming certification that does not cover the contamination risks parents are paying the premium to avoid. In 6th place, the most egregious price spread in the infant formula market. In the infant formula market, which is quite vast, sits within a single parent company's own product lineup. Reckitt manufactures both Enfamil Infant, the standard formula, retailing at approximately $22 to $26 for a 20.7-ounce tub, and Enfamil NeuroPro, the entry 10 formula in this countdown, retailing at $35 to $42 for the identical volume. Both are Reckitt products. Both meet FDA 21 CFR Part 106. Both are produced within the same Mead Johnson manufacturing infrastructure. According to Reckitt's 2023 annual report, the NeuroPro pricing premium is explicitly categorized as part of the company's premiumization strategy within its nutrition segment, a financial architecture, not a nutritional one. The sole ingredient difference is the addition of bovine MFGM, a dairy processing fraction, that independent researchers, as cited in Advances in Nutrition, conclude lacks sufficient evidence for a general recommendation. Two formulas, same parent, same FDA nutritional floor, one carrying a $13 to $16 retail premium per can, to fund a brand tier its own manufacturer describes as a pricing strategy. What neither Enfamil label discloses is that the FDA nutritional standard beneath both is identical and available for under $18. You are paying for the brand tier, not for superior nutrition. Number 5. Kirkland Signature Infant Formula takes a direct approach to a category built on opacity. The label names its manufacturer. A 34-ounce tub retails between $17 and $22. Perrigo Nutritionals, the named manufacturer, produces private label infant formula for Costco, CVS, Walgreens, and Target, to the same FDA 21 CFR Part 106 nutritional specifications governing Similac and Enfamil. Perrigo Company plc, listed on the New York Stock Exchange under the ticker PRGO, documents its private label infant formula manufacturing operations in annual filings, confirming it produces the same base formulations for store brands and branded manufacturers alike. The markup lands at approximately 2 to 3 times the production cost, a fraction of the multiples carried by every formula in the first half of this countdown. No hospital distribution rebates, no MFGM premiumization narrative, no qualified health claim printed above an FDA uncertainty disclaimer. For consumers, the value is documented. You are paying for the same FDA-mandated nutritional profile at 40 to 50% of the branded price, not for a marketing infrastructure that starts at the point of birth. Number 4. Parents' Choice Infant Formula makes its manufacturing relationship visible before purchase. The label lists Perrigo Nutritionals as manufacturer and cites compliance with FDA 21 CFR Part 106, the same regulatory standard printed on Enfamil and Similac. A 36-ounce tub retails between 14 teens and 8 teens. Perrigo Company plc, listed under NYSE ticker PRGO, discloses its private label infant formula manufacturing in annual filings, confirming production to identical FDA nutritional specifications regardless of the retail brand on the can, at approximately 0.41 per ounce against Enfamil NeuroPro's 1.85 per ounce at retail. The cost differential between the two is 350%. The FDA nutritional standard underneath both is not. Walmart's direct procurement from Perrigo eliminates the wholesale distributor layer. That adds approximately 15 to 20% above manufacturing cost to branded formula pricing before it reaches a shelf. For consumers, the transparency is on the label. You are paying for FDA-compliant infant nutrition, not for a hospital access machine or a premiumization strategy. Number 3. Up & Up Infant Formula targets store brand, eliminates the wholesale markup layer that inflates branded formula costs before they reach a shelf. A 36-ounce tub retails between $16 and $20. Target's direct procurement from Perrigo Nutritionals removes the distributor step that typically adds 15 to 20% above manufacturing cost to branded formula wholesale pricing. Every Up & Up product page lists the manufacturer, the FDA compliance standard, and the complete ingredient declaration. A level of pre-purchase disclosure absent from Enfamil, Similac, and Gerber, whose product pages lead with proprietary blend names and branded ingredient systems rather than the underlying commodity components. The markup lands at approximately 2 to 3 times the production cost, reflecting the regulatory compliance infrastructure. Not a hospital access program, a manufacturer-sponsored clinical study, or a 40-year organic heritage premium. For consumers, the savings are structural. A cost layer was removed, not a nutritional standard. Number 2, Bobby Organic Infant Formula has redefined pre-purchase transparency in the premium organic segment by publishing its complete bill of materials on every product page. Each ingredient is listed with its source, its function, and its certification status. Disclosures absent from every brand in the first half of this countdown. The formula is manufactured to both FDA 21 CFR Part 106 and the European Union's Commission Delegated Regulation, EU 2016-127, the stricter of the two regulatory frameworks on heavy metals thresholds and ingredient purity limits. For consumers, the transparency is on the label. The dominant fat source in most standard formulas and the subject of peer-reviewed research in pediatric nutrition literature, documenting palm oil's formation of insoluble calcium soaps in the infant gut and its documented effect on fat and mineral absorption. Third-party testing results are publicly accessible on Bobby's website. Organized by production batch, a 14-ounce can retails between $45 and $55. A premium grounded in dual regulatory compliance and disclosed ingredient sourcing, not in a hospital distribution agreement or a manufacturer-sponsored clinical trial. For consumers, the value is specific. You are paying for verified dual framework regulatory compliance and disclosed ingredient origins, not for a branded claim. And finally, in first place, Kendamil delivers a level of supply chain transparency that stands alone in the infant formula market. Every Kendamil carries a clear disclosure of its whole milk base. Whole milk sourced from farms within 30 miles of the Kendal, England manufacturing facility, not the skimmed milk plus added vegetable oils that form the nutritional base of every major US formula brand. The facility holds concurrent certification under UK Food Standards Agency Infant Formula Regulations, EU Commission Delegated Regulation, EU 2016 R127, and FDA 21 CFR Part 106, three simultaneous regulatory frameworks, each with published compliance documentation accessible before purchase. The formula contains no palm oil. Peer-reviewed research in pediatric nutrition literature documents palm oil's formation of insoluble calcium soaps in the infant gut and its effect on fat absorption, a mechanism Kendamil's formulation specifically and transparently avoids. A 28-ounce tin retails between $35 and $45. The direct-to-consumer model through Kendamil's own platform eliminates the retail markup layer, holding the final price at approximately 2 to 3 times the production cost, a ratio that reflects verified ingredient sourcing and tri-regulatory compliance, not a branding machine. For parents, this is the rare case where the label, the ingredients, and the price are all in honest alignment. Across all 10 formulas, one pattern holds. Price does not reflect nutritional quality. It reflects the cost of hospital infrastructure, proprietary blend theater, and a branding machine assembled at the point of birth. In infant formula, what you pay for is almost never what goes into the can. Value is not found in the NeuroPro label or the organic certification. It is found in the FDA standard underneath both. Read the standard, choose the manufacturer.